Coming up next on the Paw Report, we're talking about spay and neuter trends. Heidi Phillips from the University of Illinois Veterinary Teaching Hospital is here to tell us all about what's the latest trends, research, and what you need to know about spay and neutering your pet. Stay tuned, that's next on the Paw Report. Production for the Paw Report is made possible by
Inyurt Tire and Auto Center in Charleston and Mattoon. Inyurt offers complete auto repair. Inyurt Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyurt.com.
Hello and welcome to this episode of the Paw Report. I'm your host, Kate Pleasant, and I'm joined today by Heidi Phillips. She is an assistant professor at the University of Illinois Veterinary Teaching Hospital and small animal surgery, right? Yes. So that's kind of a broad range of things, but we're going to narrow it down today to talk about spay and neuter trends that are going on right now. But first, let's get to know you a little bit. So do you want to tell us how you got into veterinary medicine?
Yeah, I was one of the lucky people. I had a lot of classmates who had other careers before being a veterinarian. I always knew since I was a child that I wanted to be a veterinarian, and so it was pretty straightforward for me. I went right from high school to college to veterinary school and then on to an internship in residency in surgery.
Okay, so it was a simple decision for you.
It was an easy decision for me. There's nothing else I wanted to do in life.
Okay, well that's good to know. So when we're talking about spaying and neutering trends, before we get to the actual trend part, do you want to tell us first what spaying and neutering is?
Sure. Well, most people, the colloquial term spay generally applies to female dogs, and what we call it is ovariohysterectomy or ovariectomy, meaning either the ovaries or the ovary and the uterus are removed to make the animal basically infertile. Neutering generally refers to castration, which means that we're removing the testicles of a male animal.
Okay, and so when is the appropriate time to do this, and why is it important to spay or neuter your pet?
Yeah, it's very important to spay and neuter your pet. As a responsible pet owner, we do encourage people to do that. Generally, the best time to do it, on average, is about 6 to 9 months of age. We like to catch the female dogs and cats generally before their first heat. And that way, we are able to give them the greatest protection against certain cancers, like mammary cancer. If we catch them after that heat, there is still some protection conferred against things like mammary cancer, but the protection is less at that time. So we like to get them before their first heat, generally between 6 to 9 months of age.
Okay, and are there other thoughts on that? Is there another camp? I mean, are there people that don't think that way?
There is. Because of the overpopulation of animals in this country and all over the world, an association of shelter veterinarians got together and tried to decide upon the utility and the advisability of offering pediatric spay and neuter. For some people, that is around 4 months. For other camps, that's anywhere from 6 to 16 weeks of age, which can be quite young. And so there is still some controversy surrounding that particular topic.
Okay, so is it generally, by most veterinarians, not recommended for pediatric spay and neuter?
Generally, most veterinarians that aren't shelter veterinarians will recommend that an owned pet be spayed somewhere older than 4 months of age. Again, generally around 6 to 9 months of age. For animals that are in shelters, being neutered or spayed earlier in life might increase the chances that they would be adopted and decrease the chances that they would be euthanized. And so in that situation, we might be more apt to recommend that they be spayed earlier or neutered earlier in life.
Okay. What about, dogs that are bred or show dogs or things like that? Is that a different situation?
It is a different situation, and certainly we try to accommodate clients and breeders as much as possible, educating them on the advantages and disadvantages of spaying or not spaying, or neutering or not neutering their pet. Certainly there are risks to not neutering a pet, and we can certainly talk about those, but within the breeding community, certainly it's necessary for the dogs and cats to retain their reproductive organs, and so we try to work with those breeders to bring about the best possible health of the animals and the puppies and kittens that are born.
Okay, so let's make a little list real quick about the pros and cons, the
Sure.
spaying and neutering that you kind of go over with people when they come to you.
Yeah, well, the pros are definitely regarding the animal population in this country and around the world of animals that are homeless, that don't have homes and that are considered abandoned or unowned. And unfortunately, a survey was done back in the 90s to evaluate about how many animals, cats and dogs, are euthanized each year in this country. And it was thought to be over 2 million possibly each year that are euthanized as a result of overpopulation.
Okay.
And so certainly spaying and neutering our pets decreases the risk of overpopulation and decreases the risk that that particular animal would be surrendered to a shelter because of behavior abnormalities or other issues that they might have with being intact.
Okay, and so what is the typical spay and neuter process like? How does that go when someone comes to you or any veterinarian? How does that go?
Yeah, it's uncommon for people to come to me because I'm a specialty surgeon, but we do certainly see animals that are high risk for anesthesia or have other complications such as bleeding disorders where it would be best to be seen by a specialty surgeon. But certainly most spay and neuters occur at the level of the general practitioner veterinarian. And typically an appointment would be made, certain blood work and a physical examination would be done to make sure that the pet is a good candidate for surgery and anesthesia. And if that were the case, then typically that would occur usually that day or sometime that was reasonable for the owner to schedule. And most of those dogs or cats would either stay overnight or go home the same day with care to be followed up at home.
Okay, and so what kind of care do you follow up with at home? Is that something that's manageable by the average pet owner?
Yeah, typically at a specialty hospital, the animals that we get, we're probably going to keep overnight. The biggest concern that we have is managing an animal's pain. Animals show pain sometimes very differently than humans, and so it might be hard for an average owner to discern whether their pet is painful. And so we like to take that upon ourselves and make sure that they're comfortable on oral pain medications before they go home. So in the hospital setting, they would be on IV pain medications or injectable pain medications to ensure that they're comfortable by the time they go home. But for an owner that's home, they would like to just make sure that their pet is waking up appropriately. It might take 1 to 2 days for them to return to being, of normal activity.
And that's good to know. 1 to 2 days is a lot longer than you might think in your mind.
Exactly. So. They're not just going to pop back up. And,
sure.
We do expect a lot from our animals because they are so good. They have such great dispositions. But if we were to think about what our situation would be going in and having that kind of procedure done, we would probably be, painful for a long time and laid up for weeks. And so the fact that our animals return to activity so soon is just a testament to their great disposition. But we should assume that they probably are uncomfortable and painful. So an owner should keep an eye on that, whether they're eating and drinking appropriately, whether they're urinating and defecating appropriately, and whether their activity level is returning to normal. Certainly locally, looking at the incision is an important thing, especially keeping the animal from getting at the incision. Owners tend to have compassion for their pets and not want to put those collars on because they can be bothersome.
Shame, as they're called sometimes.
Exactly, the Elizabethan collar. But it is recommended because unfortunately when an animal gets bored or they're lonely, the first thing they might do when an owner is out of the house is go after that incision. They can certainly cause themselves a lot of trauma, even eviscerate their intestines and have major problems. So we really advise making sure that the pet can't lick or chew at the incision and that the owner is evaluating the incision at least twice daily to look for swelling, heat, pain, signs of infection or inflammation.
Okay. And so I assume it's a lot like a people surgery. You kind of mentioned that, how we're kind of slow to get everything. It cuts through muscles and everything, so I assume the healing process is similar to people?
It is. I think, again, our animals' dispositions are so wonderful that they return to what appears to be a normal level of activity and happiness probably more quickly than we would. But it is very the same. We have to cut through skin and then the subcutaneous tissue, which is fat, and other layers, and then through the actual body wall, which is muscle, to open the abdomen and actually get to the ovaries in a female. In a male, it's more simple. It's actually just a skin incision that allows us to exteriorize the testicles and go ahead and castrate the animal.
Okay. And so what are the latest trends in research that we're finding with these procedures?
Yeah, a lot of what we're aiming towards now is a more minimally invasive approach to spay and neuter. So in recent years, laparoscopic spay has become increasingly popular, and that's where we can actually use a video camera inserted through a very small portal into the abdomen, as well as another instrument portal. So the incision size is greatly reduced in those situations. We're able to get better visualization of the actual organs that we're removing, and to make sure that we diminish bleeding and other complications associated with the procedure. So it's all done with the assistance of laparoscopic instruments and a camera, and the ovaries are removed similarly. In most cases, it's just the ovaries that are removed, but we can do a laparoscopic assisted procedure where both the ovaries and the uterus are removed via a slightly longer incision.
Really?
Yeah.
And is that beneficial? I mean, is it more efficient? Is it safer?
Yeah, there have been studies to show that animals are less painful. They tend to recover activity more quickly. There tend to be fewer incisional infections associated with a laparoscopic spay. Unfortunately, one of the major components of laparoscopy, in order to see once the camera and portal are placed into the abdomen, air has to be insufflated into the abdomen to actually distend everything and give us a wider field of view. In people, they report that distension with air can be painful. And so there might be a little bit of discomfort associated with that, but we do think it's offset with the size of the smaller incision and the increased return to comfort and activity.
Okay. And so is there anything other than the laparoscopy that's becoming popular as well? I mean, laparoscopic, of course, that's popular in people medicine too, but are there any other trends that are coming about?
There are questions that I get. I wouldn't say that it's a trend. People are asking about, being able to retain the testicles or retain the ovaries, because there have been some studies that have possibly implicated spaying and neutering your pet in increasing the risk for other diseases. And so that's become a hot trend amongst some folks that are discussing these things. Unfortunately, there's not concrete evidence or concrete studies to say that spaying and neutering would predispose to certain diseases like cancer. But we have seen some studies where cancers like osteosarcoma, which is a primary bone tumor, or hemangiosarcoma, which is a tumor of the lining of blood vessels, that we can see that those seem to be more common in animals that are spayed and neutered. That being said, the animals that present to hospitals and that present for diagnosis, much more of our population are spayed and neutered animals. And so probably spayed and neutered animals are overrepresented in the hospital population in general, and it may just be an artifact of that is showing that some of these animals might be predisposed to cancer. So at this point, veterinarians are still recommending that spaying and neutering your pet is best, again, to decrease overpopulation, but also to decrease diseases that can be associated with retaining one's hormones or those particular organs themselves.
Yeah, I'd heard golden retrievers. There's kind of a controversy with that.
Yeah, some of the dogs like golden retrievers and the large breed dogs that are more predisposed to certain tumors like hemangiosarcoma of the spleen or liver, or osteosarcoma of the bone. Certainly breeders and owners of those animals, do have a reason to be a little bit more concerned and to talk with their veterinarian to make the best judgment possible. But again, the consensus amongst veterinary surgeons and the veterinary community in general is that spaying and neutering pests is still the best thing to do.
Okay, so no concrete evidence like you said before.
No.
And I imagine, like you said, it would be hard because so many animals are just automatically spayed and neutered. So you're studying animals that are automatically having that done.
Right.
There's a very small population of animals that do not have that done, and that would be a small population to study. So probably a lot more research that needs to be done there, do you think?
Definitely.
Okay.
And in the interim, if I had a large breed dog, I wouldn't hesitate to have them spayed or neutered. I think that is the cost-benefit ratio is definitely in favor of spay and neuter at this point.
What is the average cost of a procedure like that?
It certainly depends on where you have it done. Generally with general practitioners or your local veterinarian, you're going to be along the order of somewhere between $200 to $400 or so, depending on whether it's a castration or a spay, a dog or a cat, and how long the procedure might take. For some of the at-risk breeds, or breeds that are predisposed to bleeding disorders like hemophilia or von Willebrand's disease, for instance in Dobermans, or for animals that have breathing disorders where what we call them is brachycephalic, so the pushed-in face breeds.
Right.
Like
the
Shih Tzus and Bulldogs and Pugs, et cetera, they can have much more difficulty with anesthesia. And so they're often referred to us at a specialty hospital so they can have an anesthesiologist monitor them more closely. So in those situations, there might be a little bit more expense associated with the added risk, but still the spay and neuter procedure itself is still roughly about $200 to $400.
And it seems like a lot of local veterinarians, area veterinarians run clinics and things too, where, they have the half prices and things like that. So maybe that's something good to look for.
Definitely. There are volunteer organizations and other things that are spurred, fundraisers and such that are spurred, or just volunteer operations that are spurred to try to offer low-cost spay and neuter so that as many as possible of our pets in the region can have the benefit of being spayed and neutered and helping to decrease overpopulation.
It's also a good thing to note when you're buying a pet or planning to get a pet, because that is an added cost, just like grooming and things like that. So
yes.
Spay and neuter procedures would also be something to consider.
Yeah, which is one reason, too, to consider getting your pet from an animal shelter. Most animal shelters try to make sure that all of the pets are vaccinated, up to date on that, have been dewormed and checked for worms, and also have been spayed or neutered prior to adoption. So part of the adoption fee encompasses all of that, and so that's certainly one good reason to try to, if you're thinking about getting a pet, to visit your local animal shelter and try to give a home to an abandoned pet.
Right, and many times those fees can be considerabably lower than buying from a breeder or a pet store or something like that.
Pet store fees can be astronomical, although those animals do need homes as well.
Sure.
You know, there would be added costs potentially associated with getting them spayed, neutered, vaccinated, et cetera.
So is there a difference with cats? Because, you know, we talk about dogs a lot, but when you're talking spay and neuter with cats, is that different?
Yeah, certainly cats, there is still a benefit to preventing mammary masses, which is basically breast cancer, if we catch them, you know, before their first heat or before their second heat even. So we definitely want to consider spaying and neutering them earlier in life. For the males can develop some kind of sexually dominated type behaviors once they go into a pubertal stage, and so it's important to try to not let them learn those behaviors and become used to them. So if you start to notice those sorts of behaviors in your male cat, such as spraying and other sorts of things, it's a good idea to get them neutered sooner rather than later. But again, you know, between that age of 6 to 9 months is still considered one of the best times to do that. It is important to note that following spay or neuter, there can be some problems that come up, one of which being a greater tendency to gain weight. And I think we've all seen that in our spayed and neutered animals. So it is important to make sure they're getting appropriate exercise, that their diet is monitored accurately so they're not predisposed to obesity in the long term.
That's a good thing to note. It's not something that we necessarily think about, but it could be a problem.
Yeah,
so,
especially with cats that are a little more sedentary than dogs.
Right,
Yeah.
And I'm sure you can work with your veterinarian to pick an appropriate program for that animal. So
definitely.
And so you're in small animal surgery up at the University of Illinois, and what other kinds of surgeries do you do?
We really do. It's surprising. Often owners are surprised to find out that we do a lot of the surgeries that are offered in the human side of medicine. And certainly veterinary medicine tends to follow human medicine as much as we can, sometimes closer, but often, you know, within the last 20 years, we're following what they're doing many times. And so we have all sorts of specialties: dermatology, soft tissue and orthopedic surgery, neurology, oncology. So there are many different specialties in the veterinary field, through which people get board certified. So you can look for a board certified surgeon like I am, or a board certified neurologist, dermatologist, whatever you may need to help your pet. But as far as the other surgeries we do orthopedic surgeries involving joints, fractures, any kind of neurological surgery if an animal becomes paralyzed from a ruptured intervertebral disc or something like that. We can do surgery to help those dogs walk again. All sorts of soft tissue surgeries, including oncologic or cancer surgery to remove tumors. You know, any kind of infection, wound that develops. Really, if there's a problem with an animal, there's probably a surgical way that could address it if need be.
And that's interesting to note. I never really thought about brain surgery on a pet, but I guess just like people, they have problems too.
Yeah, we have neurosurgeons that can remove brain tumors. We can certainly deal with cranial fractures in animals that have experienced head trauma. And so absolutely, most kinds of surgeries on most areas of the body can be operated in dogs and cats.
Okay, and do you see a lot of one kind of surgery or another? I mean, are there anything that you do a lot of in a typical day, week, year?
Well, certainly the most common procedure, done in veterinary medicine in general would be the spaying and neutering procedures for sure. But we do often see a lot of wounds, bite wounds especially.
Oh.
In the summertime, we see a lot of animals that get hit by a car or are involved in some sort of trauma, might have a broken leg or a broken pelvis or some such thing. And so we do see a lot of those procedures in orthopedics. One of the more common orthopedic injuries is to actually rupture the cruciate ligament. In humans, they call it the ACL.
Is that like the ACL?
Exactly. You hear all the time in football players about about tearing the ACL. It's a very common disorder for dogs to get. We do think there is some sort of degenerative process involved, but it could be just related to trauma in a healthy dog. And we have all sorts of surgeries, you know, to potentially treat that, and options to suit each particular dog and each particular client.
And so dogs can fully recover from that ligament tear?
Absolutely.
That's good.
They are likely to get arthritis, but dogs generally do very well with arthritis, and there are medications that we can use, and physical therapies, and even adjunctive treatments like acupuncture and cold laser therapy and other things that can be done for animals that have arthritis and are uncomfortable.
Okay, and so for those, you know, cruciate ligament tears, is there a certain breed that's more susceptible to that? I seem to hear a lot about boxers.
Yeah.
And that. I don't know if that's really a trend or...
Yeah, boxers, pit bulls, Akitas, Mastiffs, you know, those Rottweilers, those are some of the more common breeds that we see. But any large breed dog does seem to be more predisposed, and usually the large breed dogs will develop the rupture earlier in life. The smaller breeds tend to get them as they get older, and we can actually see them in cats also, but usually it's more commonly associated with a trauma, like they fell out of bed and got their limb caught in the sheets or something like that. But cats can certainly develop cruciate disease as well.
Really? Well, that's interesting. Are there any other things that cats are more known for, that you treat cats for, or surgically at least, that...
We have seen a lot of urinary tract abnormalities in cats, and that is one of the things that I tend to focus on in recent years, and we're not sure if it's because of diet or, you know, what is happening, you know, with how we manage our cats as pets. But we've seen a lot more development of urinary tract stones within the kidneys or within the ureter, which is the tube that conducts urine from the kidney to the bladder, or even within the urethra, which is the tube that cats pee through. And so we can often see that they get obstructions because of those stones, and that we have to operate on that area to remove the stones, you know, many of the times.
That's interesting as well. So do you, you know, when you talk to patients, or I guess clients, people that are bringing their pets in, is there ways to work with plans? You know, if they come in and say, you know, I'm pretty sure my animal needs surgery, is there a way I can work with you to decide the best case of treatment?
Definitely, and that's always the case. We try to work with our referring and our primary care veterinarians who are sending us the patients to a specialty hospital, and work with the clients as well. We want to make sure that we offer the clients all possibilities. Our job is to tell them what would be ideal, and then if the ideal can't be accomplished because of finances, or they're worried about the impact on the pet, we can offer them alternatives or compromises that might bring about a more moderate result, but would still be good for the pet. And so definitely with every pet, with every financial situation, with every family, we do our very best to communicate with the primary care veterinarian and the client to come up with a plan that is most suitable for both the pet and the family. So it doesn't have to be a very expensive option. It can certainly be a middle of the road in terms of expense option that can still bring about a good result for the pet.
See, and that's good to know. I mean, we've mentioned it before on this program, but I always like to remind people that there's something for every budget, for every animal.
Absolutely.
For anything. You can do comfort, you can do repairs, anything like that. So
absolutely, and if there's a way to avoid surgery, you know, a good surgeon is someone that will let the client know that. And there have been many situations where someone's been coming to me for surgery and have actually discerned that at that point their pet didn't need surgery, and that there were alternatives that we could use that would hopefully prevent them from requiring surgery in the future. So as a surgeon, part of our job is to decide whether or not surgery is even necessary.
Okay. So. Well, Heidi Phillips from the University of Illinois Veterinary Teaching Hospital, we appreciate you coming down and talking to us about all this, and
absolutely,
I'm sure we've learned something today. So
thank you. Thank you for having me. It's good to be here.
Did you know full episodes of the Paw Report are on YouTube? They can be accessed at www.youtube.com/WEIUTV. Then just go to the Paw Report playlist and select the episode you want to see. More information about the show is also available 24/7 on our website at weiu.net under the Television tab.
When I was a sophomore in college in 1993. I bought two for $8. One passed away 6 days later, and Clark here now is 20. He does not climb anymore. He used to climb to the top every morning, top of his logs, and sun himself. And now he just, for about the last 3 years, he just can't get up to the logs anymore. So he just kind of hangs loose on the ground, and we got a heater down there for him, so he stays toasty, and he's got a good life. It was actually my dad's idea to build a solarium out there. I thought, well, that'd be a good idea, because he lived in a 10-gallon aquarium, then moved to a dog cage, and then 2 dog cages, and then dental school, he had a whole room to himself. And now here he is. Most people like it. I mean, we have people here who come by in the evenings, and they'll take their evening walk, and they'll walk by here and see what Clark's doing. They'll bring their grandkids by to check them out, and yeah, it's kind of neat. It'd be awfully hard to replace him. He's been so good because they're so small. Because he started off, he was about 3 or 4 inches long. So I think at 3 or 4 inches one, it'd probably get lost in there.
Have a video or photo of your pet doing something funny or absolutely adorable? We'd love to share it with our viewers here at the Paul Report. Email it to weiu@weiu.net and you can see it on our show. Just make sure it's video taken by you or that you have permission to share it. For more information about how to get that video or photo to us, email or call 217-581-5956.
Production for the Paul Report is made possible by
Inyart Tire and Auto Center in Charleston and Mattoon. Inyart offers complete auto repair. Inyart Tire and Auto Center cares about our community and thanks you for being a responsible pet owner. More information at inyart.com.